How important is diabetes in the eyes?
Oh, gosh, Bob, I'm glad we're doing an entire show on it because it deserves that and more. It's basically all day long, I'm seeing patients who have diabetes and who are there to get their eyes checked. So it's vitally important.
So is it important that if the primary care doctor recognizes a patient has diabetes, that the eye exam is an important part of their overall health?
Yeah, you bet. So diabetes is one of the leading causes in the world of preventable vision loss.
So why is that? What does diabetes do to the eyes?
So, diabetes, of course, everybody knows diabetes has to do with the blood sugars and having high blood sugars, that sort of thing. But at the end of the day, diabetes affects small little blood vessels. And so the eyes, especially the retina in the back of the eye, has a lot of small little blood vessels that can be really impacted by high sugars over time.
So the retina is in the back of the eye. What does the retina do?
Okay, so if you think back when cameras actually had film, they don't have film anymore, but when they did, the retina is like the film. So the lens and the cornea focus light, and that they focus the light back onto the retina, and then the retina takes that image and sends it back to the brain for processing.
So diabetes can damage the retina. It's the vessels, the blood vessels that supply the retina?
That's right.
So what happens to those blood vessels and what do you see?
So what we see when someone has diabetes, we can see a few different things. So early signs of diabetes will be very small little hemorrhages, little dots or little blots of blood.
Do we know why those little dots of blood, those little hemorrhages, do we know why they happen?
Yeah, so what's actually happening on a real kind of microscopic type of level is the little capillaries in the retina get clotted off. And so they stop being able to perfuse the blood, and so oxygen and the nutrients that the retina needs, it doesn't get there. And so along with that, you get a little bit of blood, and so sometimes you can also get a little bit of fluid, some leaking fluid. So you can see some protein and some swelling of the retina.
Can you recognize that as an ophthalmologist and you're looking at the eyes? Can you recognize those little hemorrhages?
Yes, you can.
What do they look like when you look at them?
So in the very early stages, there's something called microaneurysms. So it's just a little outpouching of those little capillaries, and that just looks like a little dot of blood. And then those are the smallest things we see, and then sometimes they're a little bit bigger, just like a little dot or a blot of blood there. Sometimes we can actually see some thickening of that retina if there's been enough leakage of fluid. That actually retina will swell and we can see some protein buildup.
When you see that, do you say, uh-oh, this person has problems, we need to get to work? Or how do you tell the patient that they've got these early findings of diabetic retinopathy?
Yeah, so that's a great question. It all depends on how much we're seeing back there and really where those areas are located. So if that leaking, for example, is significant and in this area of central vision, well, that's a situation where, vision could really be impacted, and that person probably needs some additional tests and maybe some treatment. On the flip side of that, sometimes someone will come in and we'll see one or two little dots, and it's really no big deal, but it's a reminder for those folks to keep good sugars, keep the blood sugar under good control, because that's the most important thing that folks can do for themselves. And then we start following them a little more closely just to make sure that we catch something early before it gets really problematic.
I sometimes think that people don't realize how important it is to keep their blood sugar at a normal level. Well, I'll cheat a little bit, or I'll do this, or maybe I'll cut down on eating before I go see the doctor. But there are tests now that pretty much show what your blood sugar has been for the last 3 months, and it's so important to keep it at a lower level.